Do you find that you struggle to make progress with patients with chronic pain? It may be that you've had multiple appointments with one person and you have a heart sink moment every time you see their name appear in your diary. Helping people with chronic pain is seen as the most challenging part of the job for GPs, primary care physicians, nurses and physiotherapists. Maybe this is because we're not approaching pain management in the best way possible. In this video I'll tell you what you're probably doing wrong when working with people with pain and how to avoid this. Hey friends, welcome back to the channel. If you're new here, my name's Mahin and I'm a physiotherapist specialising in pain management based in the UK. On this channel we explore ways to improve our interactions with those living with pain to help them create healthier and happier lives. Today I'm going to tell you about 4 common mistakes that healthcare professionals make when working with those living with chronic pain and what you can do about this. So let's get into it. So this involves doing a lot of the upfront work initially before we go into deciding on a management plan for the patient. This is really key because this is the bit we usually skip out at the beginning or the bit that we don't do as well. But setting realistic expectations for patients is really important. Now, when I'm talking about expectations, I'm talking about both expectations for treatment, so making sure that what you offer aligns with what the patient's expecting from being in your service or seeing you as a professional. But I'm also talking about the expectation for prognosis as well. Now, when a patient comes to see you and they've had pain for, let's say, 10, 20 years, and they're expecting you to take their pain away and make them completely pain-free, that may not be a realistic expectation. And being upfront and honest about that initially is really important, because if the patient's expecting that you can get rid of their pain, but you're only expecting to help them manage their pain and get back to their activities, then because you're not on the same page with things, there's going to be a little bit of dissatisfaction from the patient there because they feel like they're not getting what they want. So it's really important to be honest and transparent up front about what you're able to offer and what the prognosis might look like. It can be a really difficult discussion to have initially, and it's often not a comfortable one for us to have. But from my experience, if we don't do that bit well initially, then our outcomes are just not as good with those patients. So it's better for us because it makes our jobs a lot easier further down the line. And it's also, of course, a lot better for the patient. Although it's difficult to hear those things initially, it's a lot better for them down the line as well, because their expectations are more aligned with what we're offering. So it's taking the time at the beginning of the appointment to really find out what they're expecting from you and making sure that what they're expecting aligns with what you can offer. And generally, when we're working with patients, we don't do the upfront bit as well. So we usually go through a history, we go through an assessment, and then we kind of tell them what we can offer quickly, and we rush to hand them a sheet of exercises, or we reach for our prescription pads and we prescribe them a medication. Often because we want to help, through no fault of our own, we want to help that person in front of us. But we often jump too quickly to give them a treatment because we think that's what they're expecting from us, and we don't want to kind of differ from that. So we want to make sure that they're getting what they're expecting. So we almost put the pressure on ourselves really to make sure they're leaving with something. But when we rush that bit and we don't do the initial bit first, then actually whatever that treatment is, it's not going to be as effective because the expectations are not aligned. So it's really important initially that we take the time to understand the patient's journey and expectations as well. And by listening to their journey, we can also identify what's important to them, and then we can make a collaborative management plan in agreement with the patient for what's going to happen moving forwards with the sessions they're having with you, or if you're referring them on, then you can make more of an informed decision with the patient because you know what's important to them and what they want to get back to. And this brings me nicely onto point number 2, because without knowing what is important to the person in front of us, how do we know what they want to be able to get back to? And for us then, how do we know where to focus our support and guidance if we're not sure about what's meaningful and important to that person? So often we go through the parts of their life that potentially they're not able to do, so things they may be having to avoid, whether that's certain movements or activities, or the impact it's had on their life. But actually the next part of that questioning is, what is important to them, what do they want to get back to? Because although, let's say that someone comes in with back pain and they're struggling with bending and lifting, that's fine, okay, that's one thing that can be looked at, but how do we know whether that's relevant to what they want to get back to? So they might actually want to get back into some form of work, and their work might not involve bending and lifting, but it might involve, other things like being on their feet for a long time. So that might be an area to focus on. But without asking those questions about what is important to them and what they want to get back to, we don't know where to focus our treatment and our support. And it can also be really important to ask them about kind of values and goals. And I've done a previous video on values that I'll leave a link to in the description below. But our values are what give our life meaning and direction. But like a compass, values give our life direction, and they are what are most meaningful and important to us. So again, identifying that for the patient is important, because if the patient has a real value around being close to their family or being a good parent, then we can help them engage with that value in potentially a different way to the way they were doing it before. So before, being a good parent to their kids might have involved them being quite active with them, playing lots of different sports with them. It may not be something that they can do right now, but maybe they can engage with that value of being a good parent in a different way. So it might be that they are helping them out more with creative tasks that aren't as physical, or even support with homework, reading the bedtime stories. There's other ways to engage with that value. So it's important to identify the values, because we can set some goals then around those values, and make sure that the patient's still doing what's important and meaningful to them. So I spoke a little bit about this a moment ago, and this is the idea that when someone comes to us, because we are medical or healthcare professionals, obviously we want to help that person. So the way that we look to do that is by offering a treatment. In most cases is a good thing. Obviously people are coming to us for help, so we want to be able to offer them something. But we often, in pain management, offer them treatments that only scratch the surface. So what I mean by this is, medications, as an example, we know don't have a good effect in the long term for managing chronic pain, especially chronic primary pain, where there's no underlying cause found for the pain. So the pain in itself is an outright condition. So we know that medications in the long term are not helpful. The longer we take the medications for, the less effective they become over time. So they may stick a plaster over something for a period of time, but after a while, that actually becomes less effective. So that's one thing. So medication is one thing. It's often not a long-term solution for chronic pain. The other thing is exercises. So we know the benefit of exercises, and we know that physical activity is good for pain in the long term for managing pain, but also improving function and quality of life. But if we are quickly giving someone a sheet of exercises at the end of an appointment that are quite generic, then we can run into a few difficulties. So first of all, we run into the difficulty that those exercises may flare up the pain because they're not at the right level for that person who is living with pain. The other difficulty that we have is, because they're just a generic set of exercises, they're really not meaningful to the person at all. And because they're not meaningful, they're not really that interesting to do. So we often talk a lot about compliance and adherence, and often we look at the patient and say, okay, well, they haven't been compliant with their exercises, and the blame is almost shifted over to them. But the way I see it is, if we are doing our job properly, we should be finding exercise and activities that are meaningful and enjoyable for that person to do, that doesn't flare up their pain. They may get increases in their pain, and I often explain that it's a bit of an experimentation initially to get the level right for them. But if they are coming back and saying that, okay, the exercises flared up my pain, or they're saying that I didn't do them because I didn't feel they were helping, or I just wasn't really enjoying the exercises, then we're probably not doing our job right, because we're not finding something that's individual and meaningful to that person. So what I mean by exercises scratching the surface is when we're giving a sheet of generic exercises out to someone that isn't really relevant to their values or to their goals, and isn't helping them move forwards with their pain. So that's only scratching the surface. The other thing is injections as well. So again, with injections, we know that injections can be hit and miss, especially for chronic pain. And a lot of the time, if people do get an effect from injections, they can last, some people say a few days, some people say a few weeks, some people say a few months. Some people say that, they're great and they last a few years. That's more rare, but we know that injections can be a bit hit and miss with things, and often they are a short-term solution. So offering treatments that scratch the surface, such as medication, exercises, generic exercises, and injections, are often not helpful in the long term. And this can be a big mistake that we do as professionals when people come to see us. And one of the things that I always say to physiotherapists and GPs when I'm doing some training for them is, often less is more in that first appointment. So don't put the pressure on yourself to offer something for the sake of offering something. So we don't always need to prescribe a medication, and we don't always need to provide a sheet of exercises. It's more important to identify and set expectations initially, and find out what is important to the patient. That is what we want to do in the first initial appointments when we're meeting someone. It's easier to give a sheet of exercises and write a prescription than it is sometimes to have those discussions, because those discussions can be difficult sometimes, but they are more important than the potential prescription or the potential sheet of exercises that we give. So yeah, often less is more initially. Don't forget as well, with the burden of information for patients, is a lot of people with chronic pain, they struggle with some of their cognitive processing. So we need to make sure that we're not overloading with the amount of information or amount of actionable things we're sending them away to do. So make sure that we're focusing potentially on one thing, one outcome at the end of the appointment, and just focusing on that. Often, less is more. And this brings me on to the last point around trying to fit everything into one consultation. And you probably know what I'm talking about here when I'm talking about we're getting towards the back end of the appointment and we still realise, we haven't done a physical examination and we haven't, given them any form of treatment. So we end up rushing that last bit. And by rushing that last bit, patients often report that they feel brushed off, not listened to, not fully understood, and they felt rushed in telling their story. So it kind of ruins rapport a little bit. Even if we've done the good work initially with listening to the patient's journey, at the back end of the appointment, we can really kind of ruin that rapport by trying to rush things through. And this can be really invalidating for patients as well. So we need to make sure that we're not doing this. Now, let's not forget, if someone's coming to see you and they've had pain for a number of years, it's very unlikely that we're going to have an impact on the pain in one appointment. So take the pressure off yourself in trying to do that. We don't always have to offer solutions in one appointment because this is something that they've been living with for a number of years. So it's much better that we get things right initially, do the upfront work well in understanding the patient's journey, setting realistic expectations, and identifying what is important to them before we even go into any form of treatment or management planning. So take the pressure off yourself in trying to do everything in that first appointment, and book another appointment if you need to, because you're not going to be able to solve this person's problem of pain within one appointment, within one 10, 20 or even 30-minute appointment. So take the pressure off yourself as a clinician, but also take the pressure off the patient by trying to rush them at the end of the appointment to fit everything in. To find out how to maximize the value of your interactions and build rapport within short appointment times, check out my video on 4 ways to help patients with pain in less than 10 minutes. Thanks for watching, take care, and I'll see you next week.